Hey, Steph, thank you so much. All right, kids going back to the classroom. A lot of people going back to work, people going to the mall, different indoor spaces without the masks. So there's a lot of mixed reaction that continues to pour in right here on BT as well. So joining this discussion is the Scientific Director of Ontario's COVID-19 Science Advisory Table, Dr. Peter Jüni. Good morning to you, Dr. Jüni.
Morning.
Dr. Jüni, let's get right to it here. The mask mandate in schools specifically, should it have been extended?
It depends on our behavior, actually. You just said before, without masks, and in my spontaneous reaction was, who says that? It's about us, not about the mandates, no? So if we take it slow, including in schools, and there are school boards that have strong recommendations to keep masking, and if we just start to develop a culture that we are mutually respectful, we keep masks on, we may also want to keep them on for our own sake, for our own safety, things could actually work out. The point, of course, is we're just immediately after March break, which is especially for schools a bit challenging. Schools are now the highest risk setting that we're still having, where we do a change, and kids were wherever, and we don't know how this all plays out. So as long as we take it carefully, and as long as teachers support children who keep their masks on, etc., and develop a culture which is just amenable to that, yes, we just do that slowly, etc., things could work out. We also see that in our wastewater right now.
Dr. Jüni, talking to different parents and teachers and students, often if let's say I send my kid to school with a mask, but a lot of other parents don't, well, I have no doubt that my son will probably take his off. He sees it in the classroom. How effective is it with some students and teachers wearing masks and some not?
I mean, it will decrease the risk also for the environment, with every person who is continuing to wear a mask, the risk is decreased. But of course, it's not the same as when everybody actually is just having their masks on. It's certainly then more of a protection for the wearer, but not only. No? So again, don't look at it black or white. We now just have also shown just in the very recent past, end of 2021, that people really care and they did the right thing. And, the major reason that we saw the peak happening when it did, and we didn't have more people in our hospitals and ICUs, was just people's behavior even before New Year's Eve. Otherwise, we would have seen, the peak later and much higher. And then the public health measures that came in just reinforced that and ensured that we saw a downwards trend, which was continued. So it's again the same. This time it's just about taking it slow with this famous last step that we're seeing here. But I agree with you. Could I have lived with 2 to 3 weeks longer, especially in schools? Yes, I could. That's a mentality question also. Right now, when I look at the data, they continue to be relatively stable. We start to see a little bit of viral RNA go up in the wastewater, but it's relatively slow. Fingers crossed it stays like that.
As we say goodbye, Dr. Jüni, we know that you've handed in your resignation. You're moving on to new adventures. This has been a long 2 years for a lot of people. For those on the advisory board, the science table, I can only imagine what this has been like. Some tough decisions, some unpopular decisions, but decisions for everyone's safety. So, Dr. Jüni, on behalf of a lot of people watching, whether they agreed with it or not, it has been significant to have people serve on that table, and it was significant to have you on there. Thank you very much for what you've done for this community over the last 2 years.
Thanks a lot. Thank you.
All the best. Thank you so much. Dr. Peter Jüni joining us live here. Some really great insight, and thank you for bringing that up, because that job is not easy.
Nope.
It's not easy. You're not going to please everyone.
No. You're not going to please the premier. You're not going to please businesses. You're not going to please a lot of people. That was not easy, and we wish him all the best going forward. All right, we're going to take a break.